Today in Health in Focus, we're talking about lumbar stenosis. We're going to go to the expert, Dr. Jagannathan. He is a board-certified neurosurgeon, talking about what this problem is. Just explain what this is for us.
So stenosis just means narrowing around the spinal canal or around the nerves, and lumbar stenosis, as the name implies, means narrowing around the nerves that travel out of the back of the lower back, which is the lumbar spine.
So what would a patient feel when they're dealing with this?
Typically, there are two broad categories. One is leg pain, which is most commonly what we see. Oftentimes, patients feel cramping, or what we call claudication, which just means cramping and charley horses in the legs when walking long distances. Another symptom that patients often have are back pain, and it's not unusual to see a combination of the two as well in certain cases.
So tell us how you are treating this in certain patients.
There's several treatments that are available. We always start with the non-surgical treatments, which are going to be things like physical therapy, epidural injections, things like that. When those don't work, there are several surgical treatments that are available. One of the most common is what's called a laminectomy, where you go in and you remove the bone or the disc that's causing pressure on the nerves. This is done to relieve the pressure around the nerves and to hopefully help with the symptoms. It's usually going to be most effective for leg pain over back pain. It does not involve fusion or limitation in back movement afterwards.
Okay, so that's kind of last resort there for a patient.
Exactly.
Okay, and we've got Garth here. He's from Wademan. He has had that surgery. So Garth, tell me about what kind of symptoms you were experiencing with your back.
I had leg pain, shooting pain, and a toothache type pain down my legs, and I've had it for about 9 months until I woke up from the anesthetic and I didn't have it anymore, and I was happy.
So you dealt with it for 9 months, and then did that just bring you here? Is that kind of how that worked for you?
Yeah, well, I started out with my regular physician, and we were looking for someone that could get me in and treat me, and Dr. Jagannathan here was able to see me on a Saturday afternoon.
Nice. And so tell us what the procedure was like for you as a patient.
Well, first he did the 3 epidermal shots, and then that didn't help us, so he did the laminectomy on my back, and it was like any other operation. You go to sleep, and you wake up, and everything's fine.
Great. So tell us how you're feeling today.
Feeling great. Just had the staples out of my incision yesterday, and that helped a lot.
Okay. So yeah, this was pretty recent then for you.
Yes, 2 weeks ago today.
All right. Wonderful. Well, thank you so much for sharing your story, Garth.
Oh, thank you.
Appreciate it. If you'd like to learn more about Dr. J or about this procedure in particular, you can just head to our website, 9and10news.com.